Question number 1.
True or false? Ulcerative colitis is a type of inflammatory bowel disease that causes inflammation and ulcer formation in the inner lining of the small intestine, specifically the terminal ileum. A. True. B. False. The correct answer is letter B, false. Ulcerative colitis is a type of inflammatory bowel disease that causes inflammation and ulcer formation in the inner lining of the large intestine, not in the small intestine. The inflammation tends to start in the rectum and spreads throughout the colon. The small intestine is usually not involved.
Question number 2.
Nurse Mimi is providing education to group of students about the cause of ulcerative colitis. She doesn't need further education if she says it is caused by A. Acidic diet. B. Altered immunity. C. Chronic constipation. D. Emotional stress. The correct answer is letter B, altered immunity. Although the cause of ulcerative colitis is unknown, people with this condition have problems with their immune system where an immune response is triggered in the colon without any apparent reasons.
Question number 3.
Michael was admitted with ulcerative colitis. Barium enema results showed the patient has colitis that starts in the rectum and extends into the sigmoid and descending colon. As the nurse, you know that this is what type of ulcerative colitis? A. Proctosigmoiditis. B. Right-sided colitis. C. Ulcerative proctitis. D. Left-sided colitis. The correct answer is letter D, left-sided colitis. It starts from the rectum and goes to the sigmoid and descending colon. There are 5 types of ulcerative colitis. First, we have proctitis. This is usually the mildest form of ulcerative colitis wherein the inflammation is limited to the rectum and rectal bleeding may be the only sign or symptom. Second, we have proctosigmoiditis. The inflammation that starts at your rectum and goes into the lower part of the sigmoid colon. Most of the symptoms will be felt in the lower left side of your abdomen. Third, we have left-sided colitis. Inflammation extends from the rectum up through the sigmoid and descending portion of the colon. Symptoms include bloody diarrhea, abdominal cramping and pain on the left side. Fourth is pancolitis, also known as extensive colitis. Inflammation affects the entire colon. Symptoms includes bloody diarrhea that may be severe, abdominal cramps, fatigue and significant weight loss. Lastly, we have toxic colitis. This happens when the inflammation extends into the smooth muscle layer of the intestinal wall, causing paralysis of the colon muscle. This is considered as the most dangerous form of ulcerative colitis.
Question number 4.
Michael, who was diagnosed with ulcerative colitis, is experiencing extreme abdominal distension, pain scale of 10 out of 10 in the abdomen, temperature of 103.7 degrees Fahrenheit, heart rate of 120 beats per minute and profuse diarrhea. What complication do you suspect the pain is experiencing? A. Stricture. B. Fistulae. C. Bowel obstruction. D. Toxic megacolon. The correct answer is letter D, toxic megacolon. The large intestine dilates due to the overwhelming inflammation, causing the patient to feel abdominal distension. The large intestine is unable to function properly and becomes paralyzed. Fever and tachycardia are also prominent due to an impending or possible peritonitis, which is a complication of toxic megacolon. Fistulas are abnormal connections between an organ, vessel, or intestine and another organ. In this illustration, the urinary bladder and the colon as a fistula connecting them together. This is known as enterovesical fistula. Strictures are narrowing or constriction of the lumen of a tube, duct, or hollow organ such as the intestines. Fissures are breaks or slits in tissue, usually at the junction of skin and mucous membrane. Common cause of an intestinal fissures include constipation and straining or passing hard or large stools during a bowel movement.
Question number 5.
Michael was newly diagnosed with mild ulcerative colitis. What type of anti-inflammatory medication is typically prescribed as first-line treatment for this condition? A. 5-aminosalicylates, sulfasalazine. B. Immunomodulators, adalimumab. C. Corticosteroids, prednisone. D. Immunosuppressors, azathioprine. The correct answer is letter A. 5-aminosalicylates sulfasalazine are usually prescribed for mild to moderate cases of ulcerative colitis as first-line treatment. If aminosalicylates are not working or the patient is allergic to sulfasalazine, corticosteroids are prescribed. Immunosuppressors and immunomodulators are used in severe cases of ulcerative colitis when other medications have not worked.
Question number 6.
Michael is receiving treatment for ulcerative colitis by taking azathioprine, Imuran. Which physician's order would the nurse question if received? A. Ambulate the patient twice a day. B. Administer varicella vaccine intramuscularly. C. Low fiber and high protein diet. D. Administer calcium carbonate by mouth daily. The correct answer is letter B. Azathioprine, Imuran, is an immunosuppressor medication that decreases the immune system. Therefore, the patient should never receive a live vaccine such as varicella and other vaccinations.
Question number 7.
Michael's ulcerative colitis got worse and was scheduled for ileoanal anastomosis, also known as J-pouch surgery. As a nurse, you know that this procedure is done by A. Removes the colon and rectum, which allows a pouch to be created that will attach to the ileum. This will allow stool to pass from the small intestine to the anus. B. Removes the colon and rectum and creates a permanent ileostomy. C. Removes the colon and creates a temporary colostomy. D. Removes the rectum, which allows a pouch to be created from the colon. This will allow stool to pass from the colon to the anus. The correct answer is letter A. During the first stage of a J-pouch surgery, the colon and rectum are removed and a pouch commonly in a form of a J is created at the ileum stitched together, while a temporary ileostomy is created as a passage of waste. Around 8 to 12 weeks, once the J-pouch has healed, the ileostomy is then closed and opens the end of J-pouch to serve as the new waste passage. How many correct answers did you get? I know you got it all correctly, but wait, don't forget to hit on subscribe button and turn on notification bell so that you will be notified for upcoming videos. You can also share this to your friends. Goodbye.